Okay, we're doing well on the questions here. What are the data points for release from lockdown? Example, case numbers, days free from case numbers, Nobles beds or staffing capacity. And will that be openly published, and will it be a staged release?
So we are hoping that if things go to plan with the circuit breaker, then we'll be able to actually stop, basically just open up. But we've got to be careful. If the cases are going down slowly, then it may be a staged release. But in terms of the measures, it's actually a mixture. So obviously bed capacity at Nobles is absolutely critically important. That is one of the reasons we've been doing these measures, is to maintain NHS bed capacity. But the other is also the government has an elimination strategy. So it's to basically get back to our COVID-free status.
This is a four-parter. Have any people testing positive been off the island in the last 3 months? What's the cycle threshold for the people testing positive? Have laboratory cultures been taken and tested for live virus? And are the people testing positive infectious?
Right, so in relation, well, they all interlink those questions. In terms of people travelling off island, there has been ones that have come back with off-island travel because these are the day one tests. In terms of the community testing, there isn't necessarily that travel link, as explained by the Director of Public Health, which is why we took the measures we did. In terms of the cycle of the virus, I don't actually have that information. That might be something you can direct to the Director of Public Health at one of the press briefings. She might be able to answer that for you. In terms of samples and live virus, I know we do a selection of that. We can't do that in the lab over here. It has to be done by the labs across, I believe. And in terms of infection, obviously that depends upon whether it's live virus or not, because PCR doesn't necessarily tell you that it's a live virus. It simply tells you that the RNA is present. Okay.
As understanding by the COVID-19 has developed, the list of recognised symptoms has actually changed. The World Health Organization identifies the following: fever, dry cough and tiredness. Less common, and there's aches, sore throat, diarrhoea, headaches, a few more, the taste and smell, of course. Really do as Guernsey and Jersey have done and expand the list of symptoms shown on the government website and alter the advice from 111 so that individuals with these symptoms can be tested.
Yes, I mean, we will be looking at that. We are aware that the definitions have changed. I mean, the thing is, problem with any virus is it affects everyone differently. So we would urge, and 111 does have the latitude that if they feel that the person requires testing, they can be referred for testing.
This one will just keep coming up, and we'll just ask you and you'll just repeat the answer, I'm sure. But with COVID now in the community, how can the vaccination across only 3 days per week be satisfactory?
Right, the important thing to stress is we're not doing any less vaccines because we're doing it 3 days a week. We're doing an intensive vaccine programme over 3 days rather than spreading the same number of vaccines over 7. We are limited by the supply that comes into the island. So we receive our orders as a per head of population basis of the UK orders. The UK orders from the manufacturers are spread between now and the end of September. So we will be receiving our orders in a very similar way. So we also have to make sure that we have the appropriate second doses in stock so that if there is, for whatever reason, any disruption. So, for instance, I can give an example of that. At the start, the UK, if you remember, was expecting 800,000 doses and they didn't receive anywhere close to that. They received, I think, about 300,000. So that had a knock-on effect for us. The supply we got was less. So we have to keep enough in stock that we know we can deliver that second dose. So it's not slowing it down doing it 3 days. It would just be the same number spread over 7. Doing it over 3 days allows us to pause, assess the clinical protocols, and to check that what we're doing is safe and correct.
If it remains government policy to do the second jab after 21 days, then does this mean that in 2 weeks' time we pause administrating the first jabs for 3 weeks while we administer the second to those who received the first?
No, it's continuous supplies coming through. So it doesn't mean we pause. It doesn't mean that at all. We will be doing first jabs and second jabs.
How can an elimination strategy be deemed realistic and appropriate? It's not a strategy. It would only stand a chance of being successful if the whole world was doing the same. The virus will be with us for a long time, if not permanently, just like the common cold and flu. Therefore, does an elimination strategy effectively mean the Isle of Man is to shut away from the rest of the world for as long as this virus exists? In effect, we'll be permanently locked down with 85,000 people in a bubble.
No, it doesn't. Elimination strategy is a localized elimination strategy. That is a temporary measure. So we have done it before. We have ended up with the island basically without community cases, and that's what the aim is this time. Once we're in that situation, then and the vaccine is rolling out, then other decisions can be made, because once you have the most vulnerable in society and those that are most at risk of dying or serious illness from the virus sorted out there with the vaccine, then that changes the game, so to speak. It changes what we can actually do. So that basically then means we can look at other things such as borders, such as movement, and what we need to do.
But elimination, maybe the wrong word then, really, isn't it? I mean, as the person says, I mean, we all know we've got flu, we've got colds, we're never going to be able to eliminate all that. Is that the right language?
No, it's a measure. It's the right language for now, because it is the right language to have that strategy to get it out of the community while it is a risk. But as I say, once you start working with vaccines and everything else, and we're at that point, then other decisions can be made off the back of that.
You got your dog busy there. I'll let you go
The dog is deciding it wants some attention from
Right, let's do one more.
It's one of those BBC moments.
How long do you believe big businesses will put up with the government's approach, especially the lethargic approach to vaccinations, which has previously been given as a silver bullet solution, and then allow more movement on and off the island? So I suppose that last bit, because you dealt with the first bit.
Yeah, I apologise. I just missed that, Paul. Could you just repeat that?
Really, but how long do you believe the people will put up with big businesses and allow more movement on and off the island? When can that really happen?
And like I say, that's why the vaccination programme is so crucial. The Chief Minister has referred to it as a silver bullet, but not a speeding silver bullet. Once we have the most vulnerable groups in the island vaccinated, then that does allow government to look at other options, particularly around borders, particularly around access to the island. That is the key to this.
And you're going to be doing a daily press briefing, by the way, from now on, or just weekdays, or what's going to happen?
So the plan is we're basically doing it in reverse of the way we wound it down. So we're doing weekday press briefings, and obviously, like yesterday, there'll be weekend ones if there's something important that we need to announce and get out publicly quickly.
And your hopes for this, if it's 3 weeks, the shutdown, I think you've got till Wednesday, haven't you, for 3 weeks to be ready to go. So anything after that Wednesday, we're going to have an extension? It would depend upon the background. So it wouldn't necessarily, it would depend upon the background to it, if they were linked to previous cases, and whether they were something of unknown origin. So there's different factors that will come into play there. And we're talking at the weekend, so nothing that I've seen so far as we record this at 11:20. If something does happen, will you release something? Will you go on and talk about it, or what?
I can say to you right here, right now, Paul. At the time of this recording, I've not been informed of anything further today. I know tests have been ongoing, so I can only presume that those additional tests are negative, because I've not been informed, and I'm normally informed pretty quickly if something happens. But obviously, should something emerge out of the lab testing, then we will come forward and inform the public as quickly as possible.